about the trends in facial rejuvenation at the moment? Like what can be achieved?
Good evening, everybody. I'm actually seeing a lot of non-invasive type of procedures like fillers and Botox. That's a big trend.
Yeah.
Natural facial rejuvenation, and also things like Regen PRP is one of the latest techniques that we're actually using. We draw blood, we centrifuge the blood, and we re-inject the plasma to regenerate the skin. So it's ideal for hands, for eyes, for necks. The other trend is really to look at the overall enhancements, not just one area.
Now, obviously, you wouldn't have a client just come in and say, okay, give me some Botox. It's obviously more about getting the whole full facial consultation, isn't it?
When someone comes to see me, I give them a treatment plan so that they can see what's really happening. Now, what happens is, as we age, we reabsorb a lot of the facial fat. This is how our facial fat starts to actually recede. Initially, you will see around the eye, the fat actually starts to go, and that's why you get the dark hollows, and that's why we fill those to make you look more youthful. And then all the other different fat pads start to recede, the cheek starts to recede, and you'll see a lot of people walking around with a flat triangular piece here. So if we augment that with filler, it will give you a non-surgical facelift.
Okay. There's so much misinformation out there about Botox. Can you tell us just quickly, briefly, what it is and what kind of effect it has on the skin?
Botox stops the nerve endings from working. What it does is it blocks the acetylcholine from the nerve ending to the muscle. It stops that message from contracting that muscle. And it's been used for 30 years medically. It's very safe. This girl in particular, she's had Botox in her frown area, her forehead and her crow's feet. It's just given her a little lift to the eyebrows, freshened her up. You have to get a very good injector. And really, that's so important to have an experienced injector.
Okay. Now, just to touch quickly on fillers, I wanted to know what kind of downtime are you looking at with fillers, and sort of is it something that you can really go back to work afterwards or straight away? What time are you looking at?
Look, it's very varying what the procedure is, what we do. Mostly, a lot of my girls that come in to have lip treatments, they just, can be a lunchtime procedure because I have a very, very a technique that lessens the bruising and also lessens the swelling.
And if you have any questions to ask Nita afterwards, please go over and see her, and she can advise what kind of treatment may work for you. Thank you.
Thank you.